Everybody, hello, I'm Stuart Richards, I'm an ENT surgeon. Oh, here comes Debbie. Oh, she's on an island, that's nice. But she's muted.
Oh, got stuck on my boat, sorry, I was a bit late. I'd like to introduce Mr. Stuart Richards to talk about ENT. Carry on.
Thank you. Because of the vagaries of Teams, it's difficult for you to ask questions as I'm going along because I can't see that you're asking questions because my entire screen gets taken over by PowerPoint. So if you do have any questions, if you'd like to save them for the end, then I'm more than happy to answer them. So let me see if I can manage to make this work. Excellent. The main issue is it says only meeting organisers and presenters can share. It's not allowing me to share.
Oh, hang on.
Can you change a setting? My box is greyed out.
Who can present? Okay, try again now.
My box is now live, right.
Oh, it's because you're not logged in as your Rob Jen. I think it would have let you do it if you were logged in as that, because you logged in as a guest. Yeah, it's coming through now.
Right, so if I go to presentation view, is that coming up okay?
Yes.
Lovely. So I have some delightful gory photographs to show you because I am an ENT surgeon, so I do operate on people for a living. So the first thing I thought I'd tell you is how I got here. How did I end up doing the job that I do? So obviously I went to school and got my A-levels, and then I went to Nottingham University Medical School where I had a great time and I managed to graduate successfully on time. Did some house jobs in Nottingham and then went down to Taunton for 6 months. So I drank plenty of cider and saw the southern part of the country, which was great fun. I did a range of senior house officer jobs. In those days, you had to arrange each job every 6 months. So I travelled all around the country, mostly in the northwest, so at least I could live in one place. Spent a year as a locum registrar working in jobs around Manchester, and then was appointed substantially in South Yorkshire. And I actually worked in Rotherham, Doncaster, Sheffield, and then went up to Bradford for a while to get some experience of cochlear implants because we didn't offer those in South Yorkshire. Then I decided I wanted to be a thyroid surgeon, so I organised a thyroid fellowship in Prague, not Prague, which was absolutely amazing experience. I then started working here in Rotherham as a locum consultant in 2008. I was appointed a substantive consultant in 2009, and I've been here ever since. Whilst working as an ENT consultant, I decided that I fancied doing something else as well. And I didn't only want to do clinical work. So I started to work my path into undergraduate education by becoming lead for what was called 3B specialties, which effectively meant I was supposed to be organising all sorts of different surgical specialties to ensure they delivered training to the students. And then on the back of that, the opportunity came up to become Director of Undergraduate Medical Education here, which means I'm responsible for all the medical students that set foot in this hospital. I got a few qualifications along the way. Started with my BMed Sci at medical school, then did a BMBS, which is your final qualification in order to practice medicine. Became a member of the Royal College of Surgeons of Edinburgh, did a diploma in laryngootology, then got my final exam, which is the FRCS as opposed to the MRCS, so you become a fellow instead of a member, and that was specifically in otorhinolaryngology, head and neck surgery. Then I managed to keep my nose clean and finish my training, and you then get a CCT, which is a certificate of completion of training. And then on the back of wanting to know more about education, I took on a certificate of medical education, which I did by remote learning with Dundee University whilst I was a registrar and a consultant. So what do you need at the moment to go to medical school? Well, I can talk about Sheffield University because I know a fair bit about application there. There are, in 2019, there were 273 places. They require you to have 5 GCSEs at grade 7. You need grade 6 in English language, maths and science. To ensure you're at a level that you can cope, really. Currently, you need 3 A's at A level. They need to include chemistry or biology and 1 other science, which can be maths, physics, biology or human biology, or psychology. So it is unusual for a medical school to accept psychology, but Sheffield does. You can resit, but they're only accepted once. If you have an EPQ at grade A, the extended qualification, that reduces your A-level requirement to AAB. You have to do the UK CAT, which is an independently regulated scoring system, which is very difficult to practice for. You really just have to go and do it. And you need a UK CAT of at least 2,420 out of 3,600. Or you did in that year. That varies year on year depending on the scores that people get. Sheffield don't require an application form anymore, but work experience and volunteering is essential for the interview. And then based on your UK CAT scores and your A-level grades, you are then offered the opportunity to have an interview. And these are multiple mini interviews where you have a number of different examiners. In pre-COVID times, in current COVID times, you have an online interview with just 2 examiners, and they mark all of your stations. And if you do well enough in that, you're then offered a place to study in Sheffield. And if you're really lucky, you get a place in Sheffield, and you then get to come to Rotherham. So I don't know if any of you know what that building is, but that's Wentworth Woodhouse, which is not very far from here, and is one of the biggest country houses in Europe, as it was owned by a man who was the 5th richest man in Europe when he built it, on the back of the coal mines. So what do I do as an ENT surgeon, and why do I think ENT surgery is great? Well, part of it, I think, is because we get to treat all age groups. A lot of specialties have a particular age group that they deal with, but that's not the case for ENT. So we have everyone from the tiniest baby all the way up to the most elderly adult. Again, we're a little bit unusual in that a lot of specialties have a medical and a surgical arm, gastroenterology and GI surgery, cardiology and cardiothoracics, respiratory medicine and thoracic surgeons. Whereas ENT surgeons, whilst we're surgeons, we also offer all of the medical treatment for people as well, as we don't have physicians. Because of that, we end up doing an awful lot of team working with all sorts of other people because we do such a range of different tasks. We'll run through things. Ears. So the top left is a picture of a normal ear. On the top right is a child with a bad ear infection. As we're surgeons, we also do operations. So the pictures down on the bottom left, I'll get my little arrow up. So that is a very, very small window drilled in the ear behind, that's a nerve called the cauda tympani nerve. The facial nerve is running under here, and drilled a tiny little window here, and beyond that is the cochlea. The next photo is a small hole drilled into the cochlea, and then this is a cochlear implant electrode, like this child has, and their father has a tattoo of, inserted into the cochlea to give the child hearing back again. Rhinology or nose surgery, again, that's a pretty normal looking nose. That's a foreign body. I'm pretty sure if you pull on the chain, you can get that one out relatively easily, so it doesn't require a lot of training. Under rhinology comes quite a lot of cosmetic surgery. So this gentleman's had a rhinoplasty to reduce the size of his nose. We do lots of endoscopic work, so we get to use telescopes up the nose, and this is a view up someone's nose using that telescope to see into the different areas. We do lots of sinus surgery, which is small and fiddly, using an endoscope and a television screen. Plenty of throat surgery, so again, normal throat, nasty tonsillitis, but unfortunately people will also swallow things and inhale things. So you can see a safety pin here and a coin there. I do spend a lot of time doing voice work, so I do some quite interesting procedures, and this is a procedure under local anaesthetic, putting an injection into someone's vocal cord to bulk it up and make it bigger. So as I slide through the photographs, you can just start to see a needle appearing underneath the vocal cords, and I'm trying to angle it up and aim it into the vocal cord to put an injection in, and you can see the vocal cord is fatter than it was to start with, so that allows them to get their cords together better and can speak more effectively. One of the reasons we love ENT surgery is we get lots and lots of toys to play with. If you like toys, ENT surgery is definitely the thing for you. So I use all of these toys. On the left, we've got intraoperative nerve monitoring. So we have a little nerve monitoring electrode that we can put onto the vagus nerve, and it keeps sending signals in. So while I'm operating, doing thyroid surgery, next to the nerve that supplies motor power to the vocal cord, I can check to make sure that it's safe and I'm not doing anything to harm it. To help that, we use things like harmonic scalpels, which is effectively a really fancy knife or pair of scissors, but it seals the tissue as you go to reduce the bleeding, which does reduce the time the patient stays in hospital and improves the view of the area. We also get lasers to play with, so I use a carbon dioxide laser, and there's a photograph of someone's vocal cord. That's with a big white lesion on their vocal cord, and that's a picture after we've used the laser to remove it from the vocal cord. So we can now cure early laryngeal cancer using laser surgery. ENT is great because it's interesting, so I get to go to all sorts of different places and do different things with different people. So I get to work in operating theatres. Because I work in education, I have a lot to do with examinations, that's written examinations and clinical examinations. I get to work with the education team, and because I do the voice work, I work very closely with our speech therapists, and indeed tomorrow morning I'll be doing my voice clinic with our highly specialised voice therapist to try and deal with some very complex voice problems in patients who are usually there for their third or fourth opinion. Yes, it can be challenging. There are times when I find myself standing at the front as the ENT surgeon, and the emergency department staff and anaesthetists are nicely arrayed standing behind me, waiting for me to do something in patients who are bleeding or can't breathe. It's pretty satisfying. I've got some lovely photos of general surgeons, so asleep on the floor or in cupboards, generally looking fairly haggard. ENT surgeons, of course, looking happy and contented, and that's Valerie Lund, who was one of a past president of our National Society, and she always used to look $1 million when she came to anything. As I said, we get to do all sorts of different things. So the top left picture is a picture of the cathedral in Helsinki, where you get to travel around the world, or at least we did before coronavirus, and go and visit various different places, sometimes to see what they're doing clinically and sometimes for meetings to share learning. You get involved in charity events. So there's a photograph of the colour run, where we ran round Sheffield and people throw coloured paint at you as you go round to try and raise some money for Western Park Cancer Charity. I've got 3 hopefully happy children. They look a bit older than that now, to be honest, as the eldest is nearly 16 and is making his own way in the world. And then you get to do great fun things. So this is a course that I run. Oddly, it's down in Cambridge, but that's just because that's where the lab is. But we get to spend several days with our senior trainees, training them up to improve their surgical skills. And that's a really fantastic opportunity to watch them come on and improve their skills, because they are, of course, the ENT surgeons of the future. There we go. That's what I have to say. Let me see if I can work out how to stop sharing. Close that. Oh, there we go. I think I've stopped sharing. You can tell me if I haven't.
Yes, you stopped sharing.
Perfect. So we're there. So I'm very happy to answer any questions anyone's got. I realise you're not all absolutely here about medicine, but I can only talk about what I do. So if anyone has a question, do feel free. Aha, right, I can see a question. Let me see what we've got. How did I decide to do ENT? Well, the answer is I was really lucky. It doesn't happen to everybody, but whilst I was a medical student, I was in Nottingham, but I actually went over to Derby to do my ENT surgery. And I went over there and I watched what they were doing, and they were a very interested bunch who really liked teaching. They loved having medical students there. And it was just so much fun that I just thought, do you know what? I like these people. These people are doing all sorts of different things. This really appeals to me. Unfortunately, I made the right choice, because I've never regretted the decision to do ENT surgery. So I was very lucky. Most of our students, because I do ask them towards the end of their training, haven't decided what it is that they're going to do. And that's absolutely fine, because often you need to go and look at things to decide if they're the right thing for you. But I do think as you go through medical school, you start to get a feel for the sorts of things that you like to spend your time doing. So I'll move on to the second question, which says, have you ever considered any other fields, and why did you choose ENT over them? The answer to that is yes, I did. So I thought I wanted to be an ENT surgeon, but I wasn't certain. And I certainly encourage people to explore things and look at other things. So I managed to organise to do an orthopaedic job as a senior house officer, because I wanted to have a look at it and see what I thought. And I didn't wish to change my mind. I decided, no, ENT surgery was the right thing for me. Next question is, what's my favourite part of being an ENT surgeon? I think the honest answer is working with other people. To some extent, I am a people person. I do quite like talking to people. As Debbie knows, sometimes it's quite hard to get me to shut up. And as an ENT surgeon, because we work with lots of other specialties, we work with speech therapists, dietitians, audiologists, I work with respiratory physicians, we work with paediatricians, ophthalmologists, dermatologists if you're into skin cancer. We go and sit in MDT meetings, multidisciplinary team meetings, where you sit with the X-ray specialists and the pathologists and the oncologists and all the allied health professionals. So we actually spend quite a lot of time working with other people. And I think that makes the job more interesting, because you learn all sorts of different things from people working in other areas in the hospital, whether it be nursing, whether it be allied health professionals, whether it be other doctors in different specialties. But it keeps it fresh, it keeps it interesting, and you keep learning. Any day you learn something new is a good day, in my view. How does a normal day go for you? Well, that's the thing, you see, I don't have a normal day. My timetable is so varied that I do all sorts of different things across the week. So yesterday I met a new member of staff, sorted out some paperwork, had a multidisciplinary team meeting about thyroid cancer. Then I had my outpatient session where, because my practice is now quite specialised, I see all sorts of really weird and wonderful things, which keeps it interesting. Today, I've had a meeting about a serious incident. I will be talking to the new junior doctors later. I'll try and meet with my medical team later this afternoon. Tomorrow, I've got a specialised voice clinic, which runs once a month. Then I'll probably shuffle some bits of paper around. Thursday's my day off. I'm delighted to say I have a day off a week. And on Friday morning, I'll be operating. And I think I'm looking at the wall to see I'm doing a couple of laser operations on people's larynxes, although quite often I'm doing thyroid surgery. So the honest answer is I don't have a normal day, and that's what I like. A lot of people do have relatively normal days. Lots of people have much more structured timetables. But actually, the work as a consultant it tends to be quite varied, and you do all sorts of different things. What made me want to be a surgeon? I quite like doing things with my hands, is the honest answer. It is no more complicated than that. ENT surgery is quite fiddly. So if you're one of the members of the society who likes fiddling with things like jigsaws and Lego and building things and mending things, then actually you probably got the right kinds of skills to be a surgeon. Is it difficult? I don't think it's any more difficult than anything else. I think everything's difficult and challenging. There is a certain element of surgery whereby it does require a certain person to cope with it, because if something goes wrong, you absolutely categorically are responsible for it, and it was absolutely your action that caused the harm. And it does take a certain person to be able to pick yourself up when that happens, sort it out, and then go and do it again the next day. I always think the ultimate people for that are probably neurosurgeons, because everything they do seems to me, being a non-neurosurgeon, to be such high risk that they do have some terrible things that happen. They do their best, but sometimes they can't improve people. Sometimes people do come to harm and suffer neurological problems afterwards. And to be able to pick yourself up and go and do that again the next day does take a certain kind of person to be able to do it, because there are times when you're on your own and you're just going to have to sort it out yourself. But I like it, and I like teaching my trainees how to get on and do it. So I think it's fun. How old was I when I decided I wanted to do medicine? Well, I wasn't even sure when I went to medical school, if I'm honest. I was toying. I knew I liked sciences, and I did sciences at A-level, and I did explore biochemistry. And if I'm completely honest with you, I wasn't even sure I wanted to be a doctor when I went to medical school, but I couldn't really find anything else. I figured it was a very good degree to get. And mercifully, it was absolutely the right decision, because I've never looked back. What can you do to prepare yourself to become an ENT specialist in terms of work experience and or research? Okay, so decisions over specialties are getting more challenging and not more challenging. So the government would like people to choose their specialty as early as possible, and they keep bringing forward the time that you have to make decisions over which specialty you go into. Of course, that means that if the decision is brought very early, and they're bringing what we call run-through training in more and more, whereby you do your first year as an F1, so a foundation doctor, you do your second year as a foundation doctor, and then you apply for specialty training, and then it just runs all the way through, and you do your basic surgical training, and then you go into the specialty, and you never have to interview again. of course, by the time you're applying, you don't have much on your CV because you just haven't been around very long. And they seem to be doing that more and more, and the government likes it because it gets you in early, so you don't spend time doing other things. So they get you to come out the end as soon as possible. However, if you're like me and you look at what trainees do, they then immediately go and find as many reasons as possible to slow their training down by doing endless fellowships and this, that and the other, and extra time and research, and they find a way to extend their training because they don't always feel quite ready to actually start work as a consultant when you have the final responsibility. To be honest, I think all you need to do is just try and get yourself exposed to things so that you can try and make the right decision for you. But at the end of the day, there's actually not a huge load of difference between different specialties. We all manage the service, we all do our continuing professional development and do a bit of extra studying, we all do audits, we all deal with equipment, we all deal with complications, we all look at referrals, we all look at results, we all go and sit in clinics, most people go and do things. I do operations, but other people do endoscopy, and they go to the cardiac cath lab, and they do all sorts of other procedures. And actually, there's not so much difference between the different specialties. So the next question is, what do general surgeons do if there are so many subspecialties? Well, general surgery is quite interesting. So back in the day, general surgeons were general surgeons and they did pretty much everything. Arguably, it's difficult to be brilliant at doing everything. So as time's gone by, under the umbrella of general surgery are actually a whole selection of separate specialties. And from time to time, they split off from general surgery and go it on their own. So urology, vascular surgery, upper GI surgery, lower GI surgery, hepatobiliary surgery. These are all originally fell under general surgery, but vascular surgery and urology are now entirely separate areas of their own who manage themselves. So that's just a tour through history, really. There's no real reason why they're called general surgeons or called anything. The title doesn't really matter, to be completely honest. But there really is no such thing as a truly general surgeon anymore. They are mostly GI surgeons, so gastroenterology surgeons, and they deal with acute abdomens. And quite a bit of their work is actually involved in managing the emergencies. My life is not heavily involved in managing emergencies because most of our work's quite elective, cool and calm, except for the odd crashing emergency. So yes, a general surgeon's job plan is different to mine because they spend a lot more time in their job dealing with emergencies, and it's much busier. But they still spend the same number of hours, it's just split up differently. What was working in Prague like? Fascinating is the answer. Fascinating to get a window into a different world, to see how things occur in different parts of the world. So what you need in order to be called a consultant in the Czech Republic is nothing like what you need in the UK. The UK generally trains its trainees to a higher level than pretty much anywhere else in the world. By the time you come out as a consultant, you really are very highly trained. So I asked around in Prague, and there's lots of people that call themselves consultants but don't even have the capacity to operate at all. There's a smaller number that can do some operations, but they confine themselves to very simple ones. And if you want to have what we would consider fairly bread and butter that's done in every district general hospital in the country, some of those have to go to the capital, to the main hospital, because it's the only place that does them. But because of that, if you go to Prague to go and watch thyroid surgery, in 6 weeks, I saw more cases than I see in a year in the UK, because the workload is so much higher. So from the point of view of going there for a fellowship, it was fantastic because I saw so much in such a short space of time. It really gave me the skills and the confidence to know that I could do it myself as a consultant. When suddenly, if I turned round to ask for advice, there was no one there, and it was all up to me. Okay, so those are all the questions that have been posed. I hope that's helpful. You've got 30 seconds to ask one more question if you like. If not, then I wish you all the best. Good luck with your choices in whatever it is you do.
Thank you, that's been great. And I think some really good questions have come out from that. So hopefully everyone has learnt some things. Any more questions before we wrap this session up? No, I don't think so. Thank you very much for your time, Stuart.
You're very welcome, and I wish you all the best, everybody. Oh, one.
I will see.
Thank you. You're very welcome. Right.
I will see the rest of you. What have we got? Tomorrow. This is the last session today, so I'll see the rest of you tomorrow.
Very good.
Thank you. See you later. Bye bye.